Margaret was 58 years old. She thought she was just getting old. She was exhausted all the time. Her hands felt numb. She kept forgetting things in the middle of sentences. Her doctor ran test after test, heart, thyroid, and brain scan. Everything came back normal. Then, one routine blood panel changed everything. Her vitamin B12 level was critically low. Not slightly low, dangerously low. Within 3 months of treatment, her energy came back. The numbness faded. Her memory sharpened. She felt like herself again for the first time in years. Margaret's story is not rare. Millions of Americans over 50 are walking around with dangerously low B12 levels right now, and most of them have no idea. In the next few minutes, I'm going to show you exactly what vitamin B12 does in your body, the 7 serious effects of deficiency, and why people over 50 are at the highest risk. With over 20 years in the pharmaceutical field, I've seen this overlooked more times than I can count. Stay with me. This one could change your life. Vitamin B12 is a water-soluble vitamin. Your body cannot make it on its own. You have to get it from food or supplements. It's found naturally in animal products, meat, fish, dairy, and eggs. And here's the problem. As you get older, your body gets worse at absorbing it. Not because you're eating less of it, but because something inside you starts to break down. B12 is essential for 3 major systems in your body: your nervous system, your blood, and your DNA. When your B12 drops, all 3 of those systems start to fail quietly, slowly, and dangerously. Section 3. Effect HAG1 Extreme Fatigue and Weakness. This is almost always the first sign. Not regular tiredness. We're talking about a fatigue that sleep doesn't fix. You wake up exhausted. Your legs feel heavy. Simple tasks feel like major efforts. Here's why. B12 is critical for making red blood cells. Red blood cells carry oxygen to every organ, every muscle, every cell in your body. When B12 is low, your body starts producing red blood cells that are too large and misshapen. They don't work properly. Your tissues stop getting the oxygen they need. The result is a type of anemia called megaloblastic anemia. And the number one symptom of megaloblastic anemia is crushing fatigue. Most people blame it on age. They think this is just what getting older feels like. It's not. It might be B12. Section 4. Effect #2 Nerve damage and tingling hands and feet. This is where B12 deficiency gets scary. Your nerves are protected by a coating called myelin. Think of it like the insulation around an electrical wire. Myelin keeps your nerve signals moving fast and clean. B12 is required to maintain that myelin sheath. When B12 drops, the myelin breaks down. Nerve signals become slow, scrambled, or stop completely. The first sign is usually tingling or numbness in the hands and feet. Some people describe it as pins and needles. Others say their hands feel like they're wearing invisible gloves. If the deficiency is not corrected, the nerve damage can become permanent. That's not a scare tactic. That is the clinical reality. Prolonged B12 deficiency causes irreversible neurological damage. The nerve damage can progress up the arms and legs. In severe cases, it affects balance, coordination, and the ability to walk normally. Section 5. Effect 3 Memory loss and cognitive decline. Vitamin B12 is critical for brain health. When levels drop, people experience what's called brain fog. Difficulty concentrating, forgetting words mid-sentence, short-term memory that feels like it's failing. This is so commonly misdiagnosed as early dementia or Alzheimer's that researchers have a name for it: B12-related cognitive impairment. The alarming part is this. Studies have found that people with low B12 levels have accelerated brain shrinkage, actual loss of brain volume, and the people with the lowest B12 show the most cognitive decline. Before anyone over 50 accepts a diagnosis of early dementia, B12 levels should be tested. It is one of the most treatable causes of cognitive decline if it's caught in time. Section 6. Effect 4 Depression and mood changes. This one surprises people. B12 plays a direct role in the production of serotonin and dopamine. These are the chemicals in your brain that regulate mood, motivation, and emotional well-being. When B12 is low, serotonin production drops. The result can look like clinical depression, sadness, loss of interest, emotional flatness, and irritability. There's solid research showing that people with depression often have significantly lower B12 levels than healthy individuals. And some patients who don't respond to antidepressants see dramatic improvement once their B12 is corrected. This doesn't mean B12 cures depression, but it does mean that if you're experiencing unexplained mood changes and no one has checked your B12, that's a problem. Section 7. Effect 5 Mouth sores and inflamed tongue. This one is easy to miss because it seems unrelated. B12 deficiency can cause a condition called glossitis, where the tongue becomes inflamed, swollen, and smooth. The normal bumps on the tongue surface, called papillae, disappear. The tongue turns red and sore. Along with this, people often develop painful ulcers inside the mouth, cracked corners of the lips, a burning sensation when eating or drinking. These symptoms show up because B12 is essential for the rapid cell renewal that happens inside your mouth. When B12 is low, that renewal slows down. The tissue breaks down. If your dentist keeps treating mouth sores and they keep coming back, ask your doctor to check your B12. Section 8. Effect 6 Vision problems. Here's one most people have never heard of. Severe B12 deficiency can cause optic neuropathy, damage to the optic nerve. The optic nerve connects your eyes to your brain. When it's damaged, vision becomes blurry, distorted, or faded. In some cases, people develop a condition called optic atrophy, actual deterioration of the optic nerve tissue. The good news: when caught early, supplementing B12 can halt or reverse optic nerve damage. The bad news: many people with vision changes never get their B12 tested because no one thinks to connect the two. Section 9. Effect 7 Heart disease and elevated homocysteine. This is the silent killer connection. When B12 is low, an amino acid called homocysteine builds up in your blood. High homocysteine is directly linked to heart disease, stroke, and blood clots. It damages the walls of your arteries, it promotes inflammation, it makes blood clot more easily. The combination is a recipe for cardiovascular disaster. B12, along with B6 and folate, is responsible for breaking homocysteine down and keeping levels safe. When any one of those vitamins is deficient, homocysteine climbs and your heart pays the price. This is why people over 50 with B12 deficiency are at significantly higher risk of heart attack and stroke. And most of them don't know B12 has anything to do with it. Adults over 50 are at highest risk of B12 deficiency for one main reason. As you age, your stomach produces less of a protein called intrinsic factor. The intrinsic factor is what allows your gut to absorb B12 from food. Less intrinsic factor means less absorption no matter how much B12 you eat. Beyond age, certain groups face even higher risk. People are taking metformin for diabetes. Metformin directly reduces B12 absorption and can cause significant deficiency over time. People on proton pump inhibitors, drugs like omeprazole or pantoprazole. These acid-reducing medications interfere with B12 absorption from food. Vegetarians and vegans. B12 is almost exclusively found in animal products. Plant-based diets without supplementation lead to deficiency over time. People who have had gastric bypass surgery. The surgery changes how the stomach works and dramatically reduces B12 absorption. People with autoimmune conditions, particularly pernicious anemia, where the immune system attacks the cells that produce intrinsic factor. If you fall into any of these categories, you are not just at risk. You are likely deficient right now and should be tested immediately. Section 11. Side effects and risks of B12 supplementation. Vitamin B12 supplements are generally considered very safe. B12 is water-soluble. Your body uses what it needs and excretes the rest. High-dose B12 injections occasionally cause mild skin reactions at the injection site. Some people experience mild acne when starting high-dose oral supplements. In very rare cases, people with Leber's disease, a rare hereditary eye condition, should not take high-dose B12, as it can worsen optic nerve damage. B12 supplements can interact with certain medications. Metformin reduces B12 absorption. Chloramphenicol, an antibiotic, can interfere with B12's role in red blood cell production. Always tell your doctor everything you are taking. And if you are on metformin for diabetes, ask specifically to have your B12 monitored every year. How do I know if I'm deficient? The only reliable way is a blood test. The standard test measures serum B12. A level below 200 picograms per milliliter is typically considered deficient. Some experts recommend treating anyone below 300, especially if symptoms are present. Ask your doctor for the test. It's simple and inexpensive. What's the best form of B12 supplement? There are several forms. Cyanocobalamin is the most common and least expensive. Methylcobalamin is the active form and may be better absorbed by some people. For severe deficiency or absorption problems, B12 injections bypass the gut entirely and are often more effective than oral supplements. How long does it take to feel better? For mild deficiency, many people notice improvement in energy and mood within a few weeks of supplementation. Neurological symptoms take longer, sometimes months. And unfortunately, if nerve damage has progressed too far, it may not fully reverse. This is why early detection matters. Can you get too much B12? Because it's water-soluble, toxicity is extremely rare. Your body eliminates excess B12 through urine. There is no established upper intake limit for B12. Vitamin B12 is not a luxury vitamin. It is not optional. It is essential infrastructure for your nervous system, your blood, your heart, and your brain. And the population that needs it, most people over 50, is the population most likely to be quietly running low. The symptoms are easy to miss. They creep in slowly. They look like aging, like stress, like depression, like any number of other things. And for that reason, deficiency goes undetected for years. If you are over 50, if you take metformin or acid reducers, if you eat a plant-based diet, or if you feel persistently tired, foggy, or numb, ask your doctor to check your B12. Today, not the next appointment. Today, this is a simple blood test. It could explain a lot of what you've been feeling. And the treatment, whether it's oral supplements or injections, is straightforward and effective. Don't let something this correctable steal years of your quality of life. Section 14. Outro/CTA. If this video helped you understand something your doctor hasn't had time to explain, that is exactly why this channel exists. Behind Medicine is where we go deeper, where we talk about the medications and nutrients that affect your life every single day in plain language, with real information. Hit subscribe so you never miss a video. Leave a comment below if you've personally dealt with B12 deficiency or know someone who has. Your story might help someone watching right now. And if you found this valuable, share it with someone over 50 who needs to hear it. I'll see you in the next one.